When we talk about SOAPy, of course, about quality, all the dimensions of quality, one of the things that's really important is outcomes. And a lot of times in a hospital, because we deliver episodic care, we don't have outcome data. We often measure process data. So an example, of course, is hand hygiene rates. Those are really important to raise the rates because that reduces the rate of hospital-acquired infection. But we don't often get data that we can really share on outcomes. So this is some really exciting data that Bob got from Health Quality Ontario around patients with hip fractures. And what this shows is there's a number of hospitals here in Ontario. What it shows that St. Michael's has the best risk-adjusted mortality ratio. What that means is outcome data. We know that when patients, mostly frail elderly, break their hip and come into the hospital, it's not actually the hip fracture that causes sickness and death. It's actually that they're in bed, they get pneumonia, they get congestive heart failure. And what this shows is that St. Michael's, we have the best record in the province in terms of outcome. So this is really exciting news and really goes to the quality work that we do. Now our volume of hip fractures is smaller than others, but nevertheless it's a really good story. And what it is really, we've talked lots about quality as a complex process, and this really fits in with all the things we've done on hip fractures. Many of you, I'm sure, are involved in this work over a number of years. So we have one program called Code Hip. So what the process with that is, once a patient comes in the emergency department with a broken hip, they're identified, they put on a meter, because we know that if we get their surgery within 48 hours, they do much better in terms of outcomes, pneumonia, the other things we talked about before. And this is a process that's, as you say, it requires the emergency department, orthopedic residents, anesthesia, the OR staff, the ward, all to work together. So we've made big improvements in that. As well as on the surgical side, we have excellent surgical services, as well as anesthesia, acute pain management. That works on the surgery itself. And the other thing that's a little newer, we've done quite amazing changes. Those of you on the mobility service, on mobility floor, know about this in terms of the post-op care, early mobility. Many of those patients used to stay quite a long time, and then they all went to rehab, and now their length of stay is shorter, they're up more quickly. Dr. Sarah Ward is working with health disciplines and nursing and really leading quite a change in that regard, and they go home sooner. So I think this is a really exciting story to share, because we wish we had more outcome data to share with you. This shows that the outcome is really, we're one of the best in the province, and it goes to the quality work that you all do every day. So I thought it was a great example to share with you all.